Hello, welcome back. We get Oliver again. This is the third presentation by Oliver in a row. Well, not in a row this time. We had two on, what day are we on? Wednesday, and now we're on Friday, and this is probably the one that I'm most excited about. And I love Oliver's research. I'm bigging him up right now. Hopefully he enjoys this when I ask him to do something later on. On health in players. And I'm going to pass it directly over to you, Oliver, and good luck and enjoy your presentation. I'm sure I'll be back with some questions later.
Hello, can you hear me? I can't see the Twitch chat, I'm sorry. Give me a moment. Can you hear me now? Yes, perfect. Okay, I'm sorry for that. I did everything as usual. So once again, I start and I try to be on time. So first of all, thank you very much for having me. Unfortunately, this will be my last presentation today, and I would like to take some seconds to say and extend my gratitude to the organizers. It's been nice to be able to tune in on Twitch for the last couple of hours and listen to some interesting presentations and engaging discussions. So thanks for the impressive amount of work that flows into organizing that. And now I'm shifting my attention to the presentation. Now you should be able to see the slides, but I'm not able to see the Twitch chat, but I'm just starting. I assume it's going nice. Fine. So eSport continues to grow rapidly, culturally, economically, and also as a professional pursuit. And with this expansion, the question of how this increasingly digital and competitive lifestyle affects players' health has become more important than ever. When we talk about esports and health, we often hear about two extremes. That esport players are unhealthy and sedentary, and on the other hand, that they are highly disciplined and performance-driven. The question is, what is the reality? Research has started to dive into this question, and for example, a national study in Germany by Rudolph and colleagues in 2022 reported that most players described their health as good or excellent, exercised about 2.5 hours per week, slept around 7 hours and engaged in playing esports for about 25 hours weekly. Similarly, an international study by Trotter and colleagues from 2022 found that most players were non-smokers, low consumers of alcohol, yet still failed to adhere to the global physical activity recommendations. Interestingly, however, the top 10% of players in terms of their performance were more physically active than the ones with longest and also the ones with the longest gaming hours. Major health organizations, such as the WHO, calls for reducing sedentary activity and increasing physical activity. However, public health strategies rarely consider the emerging youth cultures that are present within esports, and most guidance focus on broadly screen time, for example, and thereby missing the specific demands and routines of the competitive activity of esports. In other words, esports players might be overlooked in health promotion effects or efforts, which brings us to the practical side, the need for more research and practical implications tailored to the specific needs and realities of esport participation. And therefore, today's presentation will provide insights into health and health-related behaviors among esport players. To do so, we ran a survey study using validated measures from previous esports and health research, and the survey included demographic data as illustrated on the slide, including age, gender, nationality, body mass index, rank, and performance level. Beyond demographics, we also assessed a range of health-related behaviors, such as smoking and drinking behavior, and physical activity levels, and also looked into other indicators of physical and mental health, including depressive symptoms, for example, sleep behavior, as well as perceived social support. To recruit a representative sample, we aimed for a multi-channel approach, meaning that partners in Greece, Portugal, and Germany try to distribute and recruit participants using social media posts, send out emails within their professional and academic networks, provided information using Discord servers, such as the one by the ERN or the German Esport Association, shared it via personal networks, and even distributed the survey using a podcast episode. The data collection ran from February to July 2025, and in the end, we were only able to collect data from 413 esport players, covering about 14% of female players. The average age was 24 years, and the average gaming experience was about 8 years, ranging from 1 to 33 years. The top esport titles are represented on the bottom left of the slide, with the majority of players being engaged within League of Legends, followed by Fortnite and Counter-Strike. We also achieved a relatively fairly balanced representation across the partner countries, Greece, Portugal, and Germany, with participants from other countries such as the US or Belgium. And in terms of the performance level of the sample, we used the classification framework from Paulus and colleagues from 2024. And what we can see is that about 62% were categorized as non-competitive players, followed by the numbers of regional, national, and a smaller amount of international competitors. So we could argue that we do have a small subgroup of high-level players within our sample. Yeah, next slide. Okay. In terms of the playing time, we can see that the mean time players spent within esports was about 17 hours a week, ranging from 1 to almost 100 hours weekly. So our sample included both weekend warriors and also more professional or more engaged full-time competitors. Regarding the body mass index, we can see that the average height was about 180 centimeters, and 78 kilograms. And using the BME categories from the WHO organization, we can argue that half were normal range, were located in the normal range, but over a third were overweight or obese. That's, however, roughly comparable to the general young adult population, so not dramatically worse, but not perfect either. Regarding sleep, regarding smoking and drinking behavior, we can see that the majority, meaning about 83%, don't smoke, which is actually better than the average in many countries. But when we compare it to alcohol, things look a bit more nuanced. Here, most are no risk or low risk drinkers, but a small group, around 7%, fall into moderate or higher risk categories. Looking into the physical activity levels, we can see that roughly 43% within our sample could be classified as physically active, another 19% moderately, and the rest not really active. So again, we are presented with a mixed picture, but it challenges the stereotype of esport players as completely or primarily sedentary. About half of our sample reported no or minimal signs of depression, but around 25%, as we can see on the left side of the graph, showed mild to moderate levels, and roughly 10% were in the moderate to severe range of depressive symptoms, which indicates that while many seem fine, a notable amount of players might struggle with mood or their well-being. Sleep quality was assessed by just a basic question rating, asking participants to rate this from 1 very good to 4 very bad. And the sleep duration was just assessed quantitatively using the time when they went to bed and also when they woke up, indicating that the sleep duration was on average 8 hours and 42 minutes. And the sleep quality was very interesting. 60% described that their sleep was fairly good, but around a quarter of them said that it was fairly bad or even worse. Additionally, when we look into the MSPSS subscales, meaning the results on the perceived support, the mean scores were located around 5, which represents an answer to a question like, my friends really try to help me, rated as mildly agree. And this suggests that players felt moderately well supported by friends, significant others, and family. Given the idea that we collected data across partner countries, including Portugal, Germany, and Greece, and also had participants from other countries, it might be very valuable to compare nationalities across the descriptive data that we just shared. But as we are just in the middle or the beginning of the data analysis, and this would also require us to make a more sensitive analysis of the data and control for more confounding variables, we just thought, okay, the next very valid and solid step would be to compare them based on their playing time, because we assumed that players who spend more time gaming, more than, for example, 10 hours as a cutoff value, because we saw that it's almost normally distributed, or half distributed across the sample, would make sense and show worse health indicators among those who spend more time gaming, as this is the general narrative. But actually, we didn't find that. The only differences that we were able to find was that players that spent more time playing were on average 1.7 years older than those who spent less time playing, and that they smoked less. So people who spent more time playing sports also smoked less than the other group. There was no difference in the BMI, drinking days, physical activity, depression symptoms, sleep duration, sleep quality, or the perceived social support. I should open the chat to see if there are any notes. Okay, good. 5 minutes. Warning, good. Then we come to the discussion and we should end on time. Of course, our study has some limitations. Being a survey study, we only provided limited depth, partly to language restriction and the idea of keeping the survey concise. And we assumed that esports players are highly busy and focused on performance, so we thought a longer survey would reduce the response quality. But future research should dive into more detail on those aspects. Additionally, investigating specific subgroups such as female players would be highly valuable, and it would be also important to examine differences in performance levels, for example, whether higher performing players engage in more healthier behaviors than low performing players, as indicated by Trotter and colleagues. Additionally, investigating what are the promoting and hindering factors, such as peer support, time management, social climate, and ergonomic setups, would help us to provide better and more informed intervention strategies, which leads us to another point for future research, that this could be something very valuable to focus on, for example, physical activity, improvements, sleep quality, and team building strategies to create a healthy environment that leads them to be more physically active. Last but not least, longitudinal research designs, in contrast to our cross-sectional designs, would allow us to track changes over time and lead us to more detail. In terms of the practical implications, our findings indicate that there is no uniform risk for esport players, but there were certain groups that seem to be more prone to less healthy indicators. Practical implications also include a focus on sleep routine. So, for example, posture checks, micro breaks, warm-ups, routines, or time management. And importantly, there is no one-fits-all players, and the strategies that we provide should actually be feasible to and fit into the players' existing routines and structures. And this is something that we also need to investigate. So that's the point for both practical implications and future research. Support structures like coaches or sport psychologists and educators should provide those services and provide those knowledges, and they should also be equipped with workshops, sessions, and potential training roads to equip them with this idea. It might be essential to not frame health as something that they need to do, but it could be something that they could do to improve their performance, focusing on recovery, consistency, and skills like aim, which may increase their engagement compared to more generic health messages. So just be healthier, for example. And clubs, universities, and teams may serve as delivery hubs and role models, helping players and teams to embed more healthy habits into their life. To conclude, and I think we are almost perfect on time, to keep it short, we have comparable health patterns to other young populations. We need more nuanced research to advance this idea, and as Brian stated in the previous presentation, we might benefit from interdisciplinary research, and esports-specific support strategies and educational tools are essential. Last point, if you are interested in the project, because there's also a second study involved, you can follow the eHealth project, which is an Erasmus-funded initiative to support players in being more active and healthy. You can follow us or the project on LinkedIn, X, and the website. And that's all for now. And I'm looking forward to the discussion. Thank you very much.
Thank you very much, Oliver, and I hope you can hear me because I've just turned the audio off. One thing to go through is there's one question in terms of chat, and I can't believe you got back on time after all of those audio issues that you managed to fix, so thank you very much for sorting those out. But the one question that we had was from Susanna. I'm assuming it's Susanna because it's got the same name as she has online, was you put down smoking data there. Did you take into consideration other ways of nicotine consumption?
If we take into consideration other factors such as nicotine? Oh, yeah, great question. Thank you for that.
Other ways of
We
nicotine
juggled
consumption, so such as vaping or in relation to the nicotine pouches such as Velo, etc.
Yeah, that would have been great, and it's a limitation of our study because we just assessed the quantity of how often they smoke, and this is a massive limitation because we just assessed whether they smoke once a week. Like the question was, how many days a week do you smoke? So it's just the quantity in terms of days, but it's not the quantity in terms of do you smoke a whole pack of cigarettes, and whether they, for example, use snooze or other unhealthy behaviors. So the idea was to add very brief questions to not extend or demand too much time, but still get a lot of responses. The sad thing is that despite using a multi-channel approach, we ended up with a small sample, which indicates that 9 minutes on average to complete a survey was still a bit long, or was not engaging enough. So that this was smoking and drinking was juggling limitations, but still having this as an aspect for their healthy behavior as an indicator. So no, we did not take that into consideration.
That's a good answer. So the one thing that I want to sort of just add on to that is your questionnaire sort of aspect. 9 minutes. As someone who does research in players and trying to get them to answer questionnaires, I know that's very hard. So getting as many responses for a 9-minute survey as you did was very, very impressive. I know that you struggle to get players at the high echelons, but it's something that we've all experienced quite a lot in relation to this area. There was one question in relation from Real Mind Mex, and if you can put the reference slide back up, or are the references the same as the one in the book of abstracts? Because you can see the one in the book of abstract. I can point them in terms of that after.
Yeah, I can put them up again. Are there other questions?
Sorry, and the last question I had, I put myself on mute again, is just for if esports were equivalent to physical sports, you would expect better health outcomes than other young populations, I guess. I don't know if that's a real question or not, or it's just a statement, but that was the other one that came up in chat.
It's a good question that will resonate with me the next days, I think. I believe it's hard to say because our study just provides us with a snapshot of the health and health behaviors, also not in detail about the sample we recruited, and it lacks the context of the participants. So we don't know. We assessed also the employment status. Some are students, some are full-time workers. So there's also something that a more fine analysis will show us whether this relates to also their employment status and other factors. So it might be that the findings we just presented are specific to the sample, but I personally believe it's not that esport itself is something very unhealthy, but it's just something they do. And as Trotter's study, for example, indicated that those who really care about performance and reflect on what is beneficial for them, they also engage in more healthy behaviors. But yeah, great question.
Okay, thank you very much, Oliver. These are the questions I have in chat at the moment. If you, I know you'll be in chat from point throughout the day, so I'm sure that if anyone's got any questions, they can reach out to you. You've got one of the best Twitch names I've ever seen, Oli Baba, which is quite easy to find in relation to it. Thank you, Ollie. After 3 long talks and on 3 different days, I know that. So thank you for all your time in relation to this, and I look forward to reading through the papers. I think I've read through 2 of these papers already, so I need to just read through the last one when it comes up. But have a wonderful day.